listeners, you're listening to AAO Radiolab 1, Season 2. Today with you is a guest host, Altynay, currently first-year medical doctor, but in past I was a biology major. This season, as you remember, mostly focuses on student experience. Today we'll compare Bachelor in Biological Sciences, Medical Sciences, and nursing programs, and hopefully we'll answer all the questions that you have. Today in our studio, we have two guests representing different majors. I would like them to introduce themselves.
So hello everyone, my name is Zhazira. I am first year medical student too. My undergraduate bachelor degree is from Bachelor of Science in Nursing program.
Hello fellows, my name is Abuali and currently I am a fourth year medical sciences student and I'm glad to be here.
First, let's focus what our majors are about in general. So, Zhazira, if I ask you to describe your major in one sentence, what would you say?
So actually it's a very interesting question because when we were graduating our fourth year, we were writing an assignment, writing about our mission and the vision of our program. So how every student sees the aim of our program. And I wrote that the mission of the BSN program is to strengthen the role of nurses in the modern healthcare system of Kazakhstan through provision of high-quality education, development of nursing scientific practice, and producing highly skilled and compassionate healthcare providers. So for me, nursing is not only about studying, but also about having more emotional and compassionate skills.
Okay, cool. What about Abuali? What do you think?
If you ask me to describe my major in only one sentence, I would say progression to MD. Because ultimately the target of our program is to train undergraduate students for the curriculum of MD program and for their subsequent progression to that program.
So in general, what is usually called pre-med in our university is called Bachelor of Medical Science, right?
Oh yeah, actually we have several namings for that. The one is Bachelor of Medical Sciences, BMS, or pre-med. Both ways are okay.
Okay, so about biology major, it's when I was coming up with this question, I didn't think that I should answer them too. But if I say something about biology, I would say that it's a very interdisciplinary research-oriented major. Because biology itself is this point where chemistry, physics, sometimes even informatics join. Biology really integrates everything, and the whole curriculum of biological science, the whole curriculum we have in our university, is basically to teach us a lot of stuff, but a little of a lot of stuff.
Yeah.
So in general, this. Okay. So guys, why did you choose your majors? In short. Or not in short.
So actually, when I was studying in foundation year, there were no bachelors in the School of Medicine. So I am the first cohort actually in the bachelors in the School of Medicine here at NU. So when I saw this opportunity, I remembered someone said that there will be only 30 available places, and I thought there will be a competition, very great competition among students, and I thought I am not one of the luckiest who will be transmitted to the bachelor here, and so put the BSN as my first choice. I also put SHSS at that time as my second choice, and third was the biology. And for that time I didn't really know who I wanted to be, and so I just let the universe to decide. And when the email came that I was enrolled to the BSN program, I thought that is my path. So everything is coming to that point that I should be in the medicine, and that is why that is how I enrolled to the BSN program.
Okay. Has there been any moment in your life that you wanted to change your major?
Actually, no.
Oh.
The whole curriculum of the program, it is great, really. The professors, the schedule. I do not say that there were like easy moments, there were hard moments too, but overall I didn't want it to like change my major.
Okay. So, and also another follow-up question: is it possible to change your major when you are enrolled in Bachelor of Nursing program?
Maybe only during the first year or during the first semester of the first year, while you're having like history classes and other scientific classes, but not after the first year.
Okay. What about you, Abuali?
Before answering, can I ask the question
Yeah,
regarding the transfer? So actually, students from BSN can transfer from that major to another, but as I heard, students cannot transfer to BSN. Is it true?
I'm not sure. Maybe again it can be done during the first semester of the first year while we're having the same courses, because after that we start to have medical courses like anatomy, etc. And we had anatomy at our first year, and other students do not have it. So I'm not sure about the biology or BMS at what year you have, but we had it as a first year, so it will be harder for us and for other majors to just change the major.
So you start your education and you just dive in.
Yes.
Okay, what about BMS?
So, okay, actually my case is a little bit different because before going to the university, I was certain that I will tie my life with medicine. And at the time when I was enrolled at foundation year, there was no BMS program. There were only nursing and biology. So I thought that I will enroll in either two of these programs, but I only now realize that I'm so lucky because during my foundation year, Professor Dr. Arman Saparov announced officially that they opened the second bachelor program in NUSOM, which is Bachelor in Medical Sciences. And I thought that was my chance, and immediately after hearing that news, I decided I will enroll to BMS.
Good. How did you understand that you want to be a doctor?
Actually, it comes from my early childhood. My grandfather is a doctor, and during my early years, he showed me and become my role model and showed me the true world of medicine. And I just realized that I want to tie my life like that.
That's really cool. So you didn't want to change your major transfer?
Oh no.
No.
I was so passionate about my major, but actually there was one moment during my studies which was not so scary or so complex, but at NUSOM we cannot work officially as research assistants.
Yeah.
Which is opposite to, for example, SH students, where a ratio is strongly advised. So that moment was a little bit
Sad?
Yeah, sad. But nevertheless, I was enjoying my major.
Okay. So it's interesting that I have like very different experience from both of you. I am a directly admitted student actually, and I think Abuali and I joined NU the same year.
Yeah.
But when I was applying to NU, I didn't know that they were planning to open another bachelor program year after. So I actually had a choice, either NUFIP or
direct.
or direct, yes, and I chose direct. And why I chose biology and why I didn't just go to medical university in Astana, for example, or in Almaty, I actually answered this question during my interview. I wasn't sure that I wanted to be a doctor.
I see.
This looked like a natural, continuation of my life because both of my parents are doctors, and I actually grew up in this like discussion of medical cases, situation, etc. But I wasn't sure for myself that I really want to commit myself into this sphere because I understand how emotional I am, and I wasn't sure that I'm able to survive through that. And I also loved biology at that time, at least.
Yes.
Yeah. And
Same.
and I thought I will have 4 years to decide for my future if I go to biology major. That's why I went to I became biologist generally. And during these 4 years, why I included this question about transferring, because I myself wanted to transfer each semester at least one time. So when it was sometimes in the beginning of the semester or it was in the end. I didn't see myself as a biologist. I wasn't really interested in some courses. Now I understand why, because medicine is my passion, not the biology, because biology is a very diverse field. You have microbiology, you have another types of biology that I studied during my bachelor year, but I really enjoyed anatomy and all medical related courses. But I wasn't really enjoying other courses, especially these biological technologies, biotechnologies, these methods, etc. That's why I'm really glad that I went to MD. So but yeah, I think even though I didn't want to, I don't see myself as a biologist, I'm really grateful for my major for showing me the true path. My path. Thank you for teaching me who I am and understanding who I am. So it's generally this kind of attitude to my major. But yeah, I love bio department, by the way.
Actually, about the transfer, when we were just enrolled to the program, there were 13 of us, and after first semester, one of us transferred to SHSS.
Yeah, actually, I know that person.
Yeah. So I don't know his aims, what he was aiming for, but he transferred, he did it, and I'm not sure if he could have done it after first year, so it would have been harder for him.
Okay, so since we're I think majority of people who are listening to this podcast are thinking about medicine in general, and maybe they don't know which major to choose. And now let's share about our experience of how we got into MD and what is the difference between all of our programs. Okay, let's now start with BMS, because BMS has a very unique case.
Oh yeah, as I answered before, how I can describe my major in one sentence, I said that's a progression to MD, and our program is really unique in that sense, because the whole target aim of our program is to really progress students from BMS to MD. And we know that actually usual bachelor program is 4 years, and MD program is also 4 years. But for BMS students, the whole path will consist of 7 years. Why? Primarily because after the third year of BMS, we are doing progression. When we're collecting the motivational letter, progression recommendation letters, and doing interview. And after that, we are either admitting to MD program, either not. And if we are admitted, then the fourth year of our BMS program becomes unofficially first year of MD, because now we are taking all the same courses as official MD first year students. And after graduating, we will continue our study at Nusoma at MD, but second year. So it will be 3 years of MD for us.
Okay. So just follow-up interesting question, just I want to know how many of you progressed? And how many of you didn't, why they didn't?
Yeah, that's interesting.
I guess that 22 of us are progressed, and only one student could not progress because of the GPA. We have a strict GPA requirement of 3.0, and if you have 2.99, you're not eligible for progression.
So is he studying? Is this person studying with us right now?
Yes.
Okay, but as a fourth year BMS student, right?
Yes, but if progress students take not only block courses but also longitudinal courses, students who are not progressed are taking only block courses.
Okay, just for listeners, what is block course? What is longitudinal courses?
In general, our MD program consists of two types of courses. The first one is block courses, which are delivered in blocks. Block system is kind of unique because you are studying one subject a whole month or a different period of time, and after that you are writing a final exam and you are closing it. And just after that you are taking another block course and another, and so on. The system for our usual courses is longitudinal, because you are taking one course or several courses over the semester, over the entire semester. And MD students take block courses in the mornings until the afternoon, and after the lunch they are taking longitudinal courses.
Got it.
So these not progressed BMS students are taking only block courses.
So for example, like we're now currently taking anatomy. Anatomy finishes on October 13, and then we'll start genetics, etc. Because like a lot of people just ask me why, and I'm like, I don't know, but I really enjoy this system. I'm glad that I can focus only on anatomy, for example. Have you had such experience during your like first 3 years of bachelor?
Actually, we had a similar schedule. It was during the fourth semester of third year. We had course named NUSOM 301. Its name is Introduction to Genetics, Microbiology, and Immunology. So it's also kind of like a block course, because we studied for 4 weeks genetics, wrote the exam on that. Then we studied microbiology, again wrote an exam on it, and finally we studied immunology. But as a final for this course, we were answering questions not only immunology but also from genetics and microbiology.
I see. Like real, like this training camp for MD students, because for us it was something new.
It was new I still actually don't understand many things, and what you were saying about the blocks and longitudinal, I think that the first time I hear about that actually. So that's interesting.
And just to finish this, like, who progressed, not progressed topic, are there anyone like who went to another master's, like to get another master's degree, like to get a master's degree in another sphere, for example?
Actually, right now I can't say that, because we are the first cohort of BMS students, and currently there are no graduates from our program. But those who are not progressed or who did not apply for the progression, they will continue their education at master programs, at other master programs. For example, master in public health or molecular medicine, and so on.
Now let's talk about nursing. You are the first cohort as well.
Yes.
And how are the graduates of the first cohort doing now? Because I know that not everyone from your program, from your cohort, is studying with us.
Yes, it is actually important to know that there are 2 bachelor programs of nursing. The first one is the Science in Nursing. It is the 4-year program that we were studying, and the second program is the 2-year program of nursing. Just nursing, for those nurses who are already working and who have a background of 3 years, as I know, of working as a nurse. So for us, as we were the first cohort, there were some, not strict like entry requirements. By strict, I mean that they are not 100% accepted, by the administration of NUSOM. So, for example, our entry requirements were presented to us only when we were starting our 4th year. So our GPA should be minimum 3.45. So 3.5. And when we knew about it, just half of our group was just, no, we are not going to go to the MD. So it was like a last minute call.
It's really tough.
It is actually. So after that, we were also said that we need to take some science courses like biology with lab and general chemistry 1-2 with lab, and it was our 4th year. So we had only, as it was said in the middle of the first semester, we had only the future spring semester to take these courses, and we were allowed to take only general chemistry 1 with lab. So for us, it was enough to like entry to the MD. So that were actually really last minute news for us. So only 6 people took the general chemistry, so others just didn't need it. So what else? We needed our recommendation letters, motivational letter, etc. And also we had an interview too. And only 6 people applied, and 4 of us were admitted to the MD program. Others were admitted to other master's degree programs here, like public health, MP Tox, toxicology, etc.
Okay, cool. So,
Yeah.
biology majors are doing usual stuff people in the US do. At least our cohort did it, because I think we were the first cohort after the pandemic who actually took MCAT and applied to MD. The main difference between Bachelor of Biology and BSN and BMS is that we actually take MCAT. So what is MCAT? You say it's a 7.5 hours long exam that tests you mentally on different subjects, and our cohort, we took it like abroad because we don't have centers in Kazakhstan. And then we also like collected recommendation letters, motivational letters, interviewing, etc. That's the only difference.
Can I add here about the MCAT? Actually, we when we were studying in our bachelor's, we thought that BSN is as a pre-med too, because in other foreign countries, in our medical schools, nursing can be considered like as a pre-med, as I know, I'm not sure. So we thought, we didn't know should we take MCAT or we shouldn't. So that is why we have always been in contact with our administration to know should we register to the MCAT or not, because there are a lot of fees that we need to pay. So unfortunately, we didn't get the answer until the registration of MCAT was already closed. So I think that is why we are the cohort that we like, not special, but
unique case.
Oh,
Unique case.
yes, we were like a unique case, really. So only because of that, we didn't take an MCAT. But for other BSN students who are graduating now, there will be a whole different entry requirements. Actually.
Oh my god.
Yes, we are really the first, I think, at the last cohort class that has like an easy entry requirements.
Yeah.
So here regarding MCAT, for us, for BMS students, during the official announcement of the program, Professor and Dr. Arman Saparov told that actually BMS students will not take MCAT. And for us, it was a really big relief because we also were known about the MCAT and its toughness, and we were just so happy that we will not take that exam.
And actually, I think one of the reasons why we didn't take MCAT, because our curriculum was not prepared for that. We didn't have science classes, etc. And because we didn't take an MCAT, our GPA requirement was high.
Yeah.
So that is why we have almost 3.5 GPA.
Okay, could you please then tell me a bit about curriculum, because like I really have no idea what like really, because as I know, that's like a lot of us take only science courses. Biology major is really very like research major. You don't have a lot of labs. You have a lot of actual science courses.
Yes, I can relate actually. What can I say? So our first year, as others, we had like
Rhetoric and composition.
Yes, rhetorics, history, Kazakh language, etc. So those were our base courses. We also had chemistry, but the easiest courses that our university can.
Oh yeah, I remember.
Chem 091. Yeah. So we had courses like Introduction to Professional Nursing. What else? Anatomy and Physiology. We had it during our first semester. So first year. And starting from the second year, we started to have actually medical courses. So all of the courses that we needed to, that our university needed from us. So we closed them during the first year. And starting from the second year, we started having medical courses like pathophysiology. So how the human body reacts, functions, etc. We had pharmacology, what else? Genetics as BMS, so medical surgical. So actually starting from the third year, we started to have more deep courses related to different departments, different systems of our body, what we had like obstetrics, pediatrics, psychiatry. We also had them. So they were like a lot of medical courses, and they were, all of them were important. Actually, all of them were interesting for us, and I think that is why. What you said about the biology, you didn't like your science classes, and you wanted more classes like anatomy, and all of these classes that you wanted to have, we had it actually, because they were all related. They were all related to the human body. So we knew the relation, we knew how our body works, and so that was our overall. And also I forgot to mention that our first 2 years, like first and second, were more theoretical, and starting from the second year we started to have a clinical clerkship, clinical practice in our hospitals. Actually, that was that had a huge importance, I think, in our actually curriculum, in our knowledge.
Okay.
So
okay, let's talk about now limitations of your major. And I have a very, this direct question to Zhazira, because in our country, unfortunately, people don't treat, they don't think that nurses are that as important as doctors, this attitude to nursing in general. And when they heard that we have Bachelor of Science in nursing, they're like, why you need that, etc., etc. So what can you answer to those people, to this critic?
So actually, of course, everything has those its limitations, etc., and our program had it too. So I can start from our program itself and then to the nursing in general. Our program has, the first limitation that it comes to my mind is that we didn't had a lot of outside of our program courses. How to say them?
Electives?
Yes, we didn't have electives. We didn't have an opportunity to take electives because of our curriculum. So in each semester we had 5 courses, and they were 36 credits. And if we wanted to take the electives that we wanted, for example Spanish or something else, it just would have been overwhelming for us because the over credit that we could have. So I think that is the first limitation. The second limitation, because we because we didn't have those science classes like you did, we don't have a lot of opportunities in the future, so in our career perspective. So most of us can go just work to nursing or something related to the nursing, mostly, or to the medicine. But to that I can also say that our program nevertheless that we have limited opportunities to like enroll to the MD program, we can continue our education in the PhD because our program focuses on the science too. It's like Bachelor of Science in Nursing. So as our program included the capstone project, so we can publish our capstone actually, and with publication we can continue our education in PhD or other master's programs. So it is not limited only in practical moment of medicine, like as treating the patient and so on. What I can say about the perception of people, actually, as my capstone project, I wrote about perception and attitude of our Nazarbayev University community towards the nursing.
Wow.
Yes, and it was actually tough a little bit because during writing my capstone project, nurses themselves had negative perception of their specialty. So it was a little bit harder than I thought. As a result of my capstone project, the overall perception and attitude of community was positive. So nurses themselves had negative attitude. But the community had the positive attitude. So it means that with time, I don't know, in the 21st century, maybe because of the new generation, etc., maybe because of our education, like including ethics, etc., most of our community thinks that nurses are an important part of the healthcare community, actually. So as an individual specialty. So everything is changes, actually.
Okay, cool. What about BMS? What is the perspective and limitations of this major?
Actually, our major has a lot of perspectives. The first and very straightforward one is continuing as MD student, being a medical doctor. But also our major is a science major. And if student doesn't want to continue as a doctor, the student might go into the research field.
Yeah.
For example, easily to the master's program in biomedicine, or continue his career in the public health, molecular medicine, or pharmacology. Also, besides of that, our students can easily enter the teaching process, academia. So as you can see, there are a lot of perspectives, but talking about limitations, with only BMS, you cannot set yourself in the clinical setting and compare it with BSN program.
Yes.
Because after graduation, you can go straight to the clinics.
Actually, we were just only 12 of us, and our phones are like ringing all the time after graduation because hospitals want to take us to them. Yes,
That's nice.
yeah, that's great actually that we are like wanted to the hospitals in Kazakhstan. So that's great. That's the greatest perspective, I think, because we will always have a place to work and everybody needs us.
Yeah. So for us, this is a limitation because we cannot work straightforward after the undergraduate program in the clinical setting, and we cannot work in industry when compared with biology major because, as I know, after undergraduate,
biology graduates can be anyone.
Yeah.
Yes.
So here we have some limitations.
So like, why you can't work in the industry?
Because our major is specified on the scientific perspective, not on the industrial. For example, if student wants to go to the pharmacology straight after the undergraduate studies, he cannot because we didn't have courses designated for that.
So they first need to take to have
at least
to go to masters.
At least masters.
Okay, yeah. So continuing this topic, actually, as I said, biology majors can be anyone who they want. I think that the main advantage, or let's say it has a lot of perspectives.
Yeah.
Because people think that we are the future biology teachers. I don't know why, but actually, like, our curriculum includes electives. We have like humanities electives, social science electives, like a lot of electives, and technical electives as well. That's why our like program, our curriculum becomes more like diverse in terms of different courses that we take. So, and after biology, you can actually go anywhere you want. Like, maybe not to the hospitals directly, but masters in any field, like PhD in any field. You can go, for example, to the industry to work in the industry. You can actually become biology teachers. I know that there are like from my cohort, there are a lot of people like who like we kind of this like uniquely divided into different spheres, because I know those who became English language teachers. I know those who became biology teachers. I know those who are now continuing their education as public health, like masters in public health programs. So there are a lot of different like career opportunities with our major. And the thing that we can work as arrays. We're encouraged to work as arrays. We are paid. And moreover, like I think our department, I know that currently the department is becoming more and more diverse in terms of different like spheres of biology. During pandemic, it was a disaster. So like we have a limited number of electives. But when I was fourth year student, there were a lot of electives that were added to the schedule. So biology major is becoming actually diverse. I think the main limitation of our program is actually that it's diverse. Like it can be an advantage, but it can also be a disadvantage, because you have to take a lot of electives, actually like a lot of electives to graduate. And sometimes you might not be good at it. You might not be like, you might even like don't want to take it. I know there are like some biology majors who weren't able to graduate because of humanities electives. So I think that I know that it's a like requirement from the university, but and I believe that it's a good requirement. However, just because we couldn't register for some courses, you cannot graduate, and it like causes like additional stress.
Yes.
So in general, I believe that a biology major helps you to grow personally. Like helps you to understand yourself, etc., etc. Because, for example, when I took anthropology courses, I really was thinking maybe I should go to primatology, because I can go to primatology with biology major. I understand the anatomy of, for example, primates. But at the same time, when you have such diverse curriculum, you don't know where to focus. You don't know how to balance everything. And sometimes there are cases that biology, like humanity or social science in your life is much more, like takes much more time than biology itself. So, and like it's this coin with two sides. Actually, yeah. So this is my answer. We talked about perspectives, we talked about limitations, and now let's make it like a majors battle, when we will present the advantages of our major over another major. And we are starting with BMS because I see that Abuali wants to say something.
Actually, yes, we have several advantages, besides of those which I already mentioned. We all know that the registration process in our university is really tough. But for BMS students, it's a little bit easier.
For BSN too.
Because our dear faculty tries to give us first priorities in all these courses. For example, we all have these core courses like business, like ethics, like Kazakh courses. And for majority of students from other schools, they have limited priorities on that.
Yeah.
But for us, we always have a first priority for that. And the reason for that is because we should close all these core courses during the 2 years. Because starting from the third year, we are going fully to NUSOM and study there. So I guess that's a really cool advantage. And another advantage is our capstone project. Actually, our capstone project is a little bit different from other majors because we have a full semester for that. The spring semester of third year is designated fully for capstone projects. We have only that, and it weighs 30 credits, and during that period you can fully diversify yourself to this topic. You can so you have no distractions like other courses or other activities. So I guess that's a really good advantage for our students.
But in terms of GPA, you either...
Yes, but in terms of GPA, that's a little bit risky. Because if you're doing great, you will be great at the end. You can easily get the increased stipend or the dean's list. But if you are doing bad, then you will lose everything, including stipend.
Yeah, that's tricky.
That's a risky, yeah. But in overall, students have a whole semester for that. So I think that it's not so hard. And if we'll judge based on our results, majority of our students got A's and B pluses. So there were no students who got C or C plus, because really we worked really hard on that.
Okay. Do you have other requirements for probation and stipend loss?
Actually, we have the same as for other undergraduate students. If you have a GPA under 2.33, you lose your stipend, and if your GPA is lower than 2, you are in probation period.
Yeah. What about BSN?
The BSN about registration of courses, it was actually the same as in BMS. Firstly, as an MD now, all of our courses were registered by our faculty during all of the 4 years. So we were registering by ourselves only those courses that were in our main campus. So biology, the science and humanities classes. And again, we had first priority too. So because we needed to close all of these courses during our first year, not the 2, but our first year. So I think that's the first advantage of the program. The second advantage, I think, is the number of people studying at the program. There are not a lot of us, but it also makes easier for us to study. So because of the small group, it is easier to communicate with each other. The networking is great. The networking with our faculty is great, because we having not only the professional relationships, but as friends too. We could have talked with our professors after classes, had tea with them, talk about our problems or our issues. If we had any stress, they were always there to help us. So it is the faculty and students relations. The next, as I said, the last 2 years of our bachelor's, we had clinical practice, so clinical experience in healthcare settings. So these opportunities actually allowed us to apply all of the theoretical knowledge that we were getting in a real life situations, so that we could have worked directly with patients and collaborate with other healthcare professionals. Also, the diverse learning opportunities, because in the scope of our courses, we had clinical rotations again in different healthcare settings, so including medical surgicals. So we had great experience in participating in actual real surgeries. So it was a great experience, really. Also pediatrics, as I said, mental health, community health, etc. So it actually gives us a chance to develop areas of interest. So for example, if we want to apply to public health master's degree, for example, after that, etc. And again, we have developed not only hard skills but soft skills too, because nursing, as a nurse, it is a very compassionate person. So they highlight the importance of the patient-centered care, not just the treatment, but like holistic approach to the patient. So being empathetic, compassionate, caring, and attentive person. So I think, that's actually what motivates nurses and motivated us as nursing students. So I think,
Okay, I think regarding biology major, we have like actually dozens of advantages. Even though registration for us is a hunger game, because I remember when there were times when the registration like took us only 1 minute.
Oh yeah.
And it's like either you got it the course or you didn't.
Yeah.
And maybe yes, we don't have like priorities for like some of the courses. I'm still crying that I couldn't take Sociology 101. But even I think this helps us to make our own schedule, and it it allows us to free time for work maybe, or for research, like working in the lab. This helps you to actually make flexible schedule where you can free some days even, like in the last semester I had lectures only on Tuesdays and Thursdays, like Monday, Wednesday, Friday were free. So it like one of the main advantages, like at least over your majors, like I know that like 90% of university registers the courses themselves, but still like you still have this opportunity to make flexible schedule. You have an opportunity to take different electives. So for example, I have a chemistry minor, and I was really interested in chemistry, so I was able to take a lot of chemistry courses during my studies. Yeah.
Oh yeah, actually about minors, that's another limitation for our school, because we cannot take any minors.
Yeah, but in SSH, people even who graduate with double major.
Oh yeah.
Yeah, I actually know such person. I'm like, wow. So yeah, one of the main advantages, at least like if you're seeing yourself in some like life science related sphere as a freshman or as a foundation year student, just remember that with biology, probably the main advantage is you can explore different sciences, explore different fields. You can even explore humanities, and with this exploration, if you understand that biology is not for you, you can actually transfer. You can change your major. It's not, this sentence for 4 years. Like if you can even change your major as a third-year student. So you can transfer to any major that you want, but not like engineering, maybe not to NUSOM, but at least you have this opportunity to change your major and actually like don't waste your time on something that you don't love. The second thing is that it actually like capstone project for our cohort was not mandatory. It was actually a course, and it was called, I think, not honorary thesis, but it was called something like that. I didn't do capstone project, but I did a lot of stuff at lab. And I think like biology majors who matriculated after me, they have to do capstone project. But the perfect thing is that you have an opportunity to work in different labs. If you want to work in engineering lab, you're welcome to do so. If you want to work at SMG, you're welcome to do so. And just because you have more time to dedicate to research, you can actually find out for yourself first, like, is the research for you or not? And then decide, like, whether you want to continue in academia, etc., etc. Moreover, you can get published with the professors, etc. So you have more opportunities to actually devote yourself to research, being an undergraduate student. And another advantage, at least at the time we're recording this podcast, is that we're not the first biology cohort and we're not the last biology cohort.
Oh, yeah.
So even though the curriculum changes, these changes are not that drastic. And you're actually studying something that was improved with years, with the feedback of students, and you actually know what are your requirements of graduation. You don't have like something new popping out during your undergraduate studies. yeah, our cohort had this experience when our curriculum was changed, but we have the opportunity to give our feedback and to actually contribute to these changes as well. So even though that there are some changes are happening, you still know what you're going to study for 4 years. You still know you have a lot of graduates of biology major who can actually guide you. You have the seniors who can give you some advice, I don't know. And by seeing this, like what seniors are doing after graduation, you can decide for yourself what you can do with biology major. So that's like being an old program is an advantage at least in this case.
True.
I have 2 last questions. Probably a lot of students who are listening to this podcast are probably future physicians in training. Like they're going to continue their education as MD students. Undergraduate experience is aimed to prepare us for graduate experience. So how your undergraduate experience, your curriculum, your school, your major prepared you to be in MD students, and possibly what would you advise current undergraduate students to do to be better prepared for MD?
So I don't think that there will be a lot of things to say because our semesters only just started, like 3 weeks. But for me, as a bioscience student, it is actually a little bit easier to at least understand and comprehend the information that is given for us in anatomy class, for example. So as we already have a background in this course, and in general we have a background of how human body works, maybe not in the detail, but it makes easier for us to understand the information. Also, again, for example, we have a course medical interviewing. As we had the clinical practice, we know how to talk, how to speak with the patient, what distance we need to have with them, what patient physician or patient-nurse relation should have been there. So it is easier to approach this. For now, I can say this, and as I will remember, I will add, I think. So maybe Abuali.
I also can relate on this because during our 3rd year, we had courses on medical ethics and biostatistics. And currently we have these courses as longitudinal courses, and actually for us it's easy now because we have covered all this material and we are really familiar with that. Speaking about anatomy, we had a little bit of anatomy during our 3rd year. It was only 5 or 6, maybe 7 weeks, but it was superficial, because we covered every system week by week, but we covered only the basic structures and the basic information. Maybe knowing the structure of the courses will be helpful for us, because we already know that what is block course and how this thing works. Also, we are a little bit adapted to absorb a lot of information and to start learning new things just after finishing another. And what I can also say is familiarity with the NUSOM faculty.
True.
Because we already know all the professors.
And they know you.
Yeah, we also know the building, so it's not kind of a new experience, a new atmosphere for us. It's like a little bit of comfort zone, I guess.
Yes. So the orientation, for example, to the NUSOM was easier for us rather than maybe for biology students. It is our comfort zone because we are familiar with the NUSOM more than with the main campus.
Oh yeah, we are strangers there.
Yeah, it's like vice versa for me because when I was for the first time at NUSOM, I'm like, why are there not so many people? Like
Yeah.
this building
Yeah, the
is so
atmosphere, yes.
quiet. Because I'm used to like, walking in this crowd, being late to the lectures, like, and especially this, old elevators in the 7th block.
Oh.
Like you have to take it with like a bunch of people. I know the secret elevator. So I think that's the main advantage for you also if you are if you are continuing your education at Nusum, because as a biology major I'm still getting lost.
Yes, it can be stressful actually
Yeah.
for some people. So this period can be stressful.
Moreover, you can feel that professors know other students.
Yeah.
And I think us not being familiar with Nusum policies also affects us. Like, yeah, I can see it. Yes, if you're a biology major going to MD, probably you will have some difficulties with the orientation. But that's also, I think, depends case by case, because my transition was I think smooth, just because I don't know, like I'm a debater in the past. I'm used to meeting a lot of new people, because like I had the whole 300 people coming to the like season opening, and that was my job. Yeah, to communicate with them, to find some this common ground, etc.
Yes.
But for some it can be stressful.
So it's more about the emotional part.
Even though it can be a bit stressful for some people, faculty is actually very welcoming, and they really help you to transition from one school to another.
Yes.
As a biology major, I think it's a bit difficult for us to catch up with the courses, because just because we had the flexibility to take the course whenever we want. I took biostatistics 2 years ago, and it was during the pandemic. And like we had more time. We had 2 semesters of anatomy, and that was really cool. The actual anatomy is like really well taught to biology majors. I know that there are some changes currently, because anatomy 1 is mandatory, anatomy 2 is an elective, but for us both of them were mandatory, and I think it's really cool because 2 semesters of anatomy actually allows you to cover a lot of stuff in a not limited time. You don't have the stress of like a lot of information at the same time. You still have like more time to study.
Biology degree is very needed if you want to transfer to the MD because of the MCAT. So because we didn't have a lot of science courses, we almost didn't have them. We just couldn't pass the exam, the MCAT exam. We just would have been prepared for that.
Yeah, that's fair.
And you have like strong background for that, strong base and foundation to pass the MCAT to go to the MD.
Yeah, I agree with Zhazira. I don't like for MCAT to actually enter MD, because what's the meaning of talking how undergrad experience is helpful for MD if we are not progressing to MD?
Yes.
But I cannot say that biology will teach you medicine. You have bioethics, which actually pretty similar to medical ethics. You have like a lot of different courses. Maybe they will be helpful when we'll learn of pathophysiology, the cell structure, cell signaling pathways, etc. Maybe it will be helpful. Currently, unfortunately, I cannot see this direct advantage of our program to help us in the academical part of the MD. But what can I say is that yes, we have to adapt, but the whole biology major teaches you to adapt to new stuff. Whole idea of our bachelor degree was actually about learning how to live, learning how to learn, learning how to communicate with professors, because we're not like we actually had a very competitive atmosphere. We had like 104 biology majors, biology students in our cohort, and it was a really big competition. And professors believe that it's our responsibility to learn. So, you also have to learn how to communicate with professors. You have to learn a lot of different stuffs in terms of skills, and it actually helps you to be more flexible to different changes. And it helps you in this term, maybe it will teach you, maybe it will prepare you emotionally to MD experience. But whatever you will do during biology major, it will probably be useful for your life in any ways. At least you will understand that something is not for you, and biology major has all the things to like it gives you all opportunities to explore the whole like world of science.
Actually, speaking about that sense, about the competition at NUSOM, especially at our major, we are not encouraged to be competitive, but we are encouraged to be cooperative with each other. And this also creates a good atmosphere, not a kind of toxic atmosphere when you are competing with your peers, but you are working together to achieve the same goal of progressing to the MD. So I guess that's an advantage for us and for BSN students. I also saw.
It is actually, because we should not forget that we are future colleagues.
Yes.
So we should be cooperative with each other.
In that sense, biology is like, well, I understand that there are a lot of biology students. Just because of that, we don't have enough. Like you can't possibly like collect all like 70, 80, 100 people to team building to get to know everyone. There was like situation when I was graduating. I like saw the faces of biologists graduate for the first time, even though we're studying kind of together for years. Yeah, but like biology major usually actually help like teaches you how to be competitive and how to use all the opportunities, etc. So that's why it was, I think, in terms of that, it was very unexpected for me that there is like this cooperation in medical, in general studies, in medical training, because you have to be the best to get the best things as a biology major.
When you are competitive, you are like highly motivated to get the best knowledge that you can get.
Yes, but that's risky because you have a chance of emotional burnout.
Yeah, there should be just a balance.
Yes.
It's again, you know, this like coin with two sides.
Yes.
Like at one side you can get the best opportunities to actually boost your CV. I know a lot of biology majors who got different internships in different international organizations, etc. But at the same time, you have to just look out whether it's like something you really want or whether it's society expects you to do. So, but in general, if in 4 years you learn how to do that, it will be really easy in the future because, well, you are prepared to adulthood. Summing up everything and finishing this episode, I would like you to share some tips for freshman students who will be listening to this podcast.
All right. Now I'm talking to all BMS students. You should really concentrate on your GPA. Yeah, sure. Study, because for us, the main criteria is GPA. As I before mentioned, if you have GPA of 2.99, you will not be eligible. For that reason, you should really concentrate on your GPA and then on your social life. But sure, you should not forget about your social life because we have so many opportunities, different clubs, volunteering opportunities, research as a volunteer, and so on. So I strongly advise you to find that balance between your academic and social life, and always know that we are here to support, to guide you. I always tell my fellow students that if you have any question or any concern, you are free to write me because I'm here to help you. Because when I was a first year student, there were no seniors or sophomores or juniors, and we were on our own. And that was a little bit stressful.
What about you, Zhazira?
I think what I would tell to the BSN students and people in general, to think before you make a decision, because after each decision there is consequences. But also do not forget to listen to your heart, because it really says what you are passionate for, as it was in your case. Nursing as a profession, it is actually a very great profession to be in, but because it is not perceived as well as it is in a society, there can be some challenges during your education, during your career, so you need to be prepared for that if your heart follows this profession. And please also be active during your clinical practice. Do not be afraid or don't be shy to ask some questions from your nurses or other physicians. They are always there to help you and to teach you. And I know that BSN students currently undergo a lot of major changes in their academic policies, etc. And here I want to say that do not be afraid to cooperate with the administration, because they are here for you, and they will do everything for your way, for your path to be easier. So do not be afraid to cooperate with them. And also do not forget to always read your emails from the administration side, because they can be a lot of new important things regarding also the work obligation, etc. So be attentive
and keep up with all updates that happen to our university policies and in general everything that's going on in the university, because Nazarbayev University is a very young university. There are a lot of things that are changing, and please just for your own
safety
for your own safety, familiarize yourself with everything that's going on inside the university.
Although our programs are new, some faculty really works hard in order to improve our program. For that reason, if you have any concerns or ideas for the program improvement, you can easily address it with administration. And if you are worried to talk directly to administration, you have your student representatives from each cohort, and through them you can address all your concerns and ideas, and they will, on the special meetings called TLC or Teaching and Learning Committee, will address all the questions, your ideas and concerns. So really be attentive and cooperative, because administration here is not to make your life worse, but you have a same goal of improving each other. They, you as a student, and you them as a faculty and administration.
And yeah, if you don't know who is your major representative is, please find it out. They also attend to these committees. For example, if you're from SSH, you can even address your questions to student government, Ministry of Education, also attending the whole, university-wide meetings and committees. They can address your concerns, and they can introduce changes that will make your life actually easier and more interesting. From my side, first of all, familiarize yourself with policies and procedures of your school. It not only tells you what not to do, but it can also reveal some other opportunities, these hidden opportunities people don't talk about, like different funding for trips, etc., etc. Second thing is to understand that undergraduate studies is a very unique time of your life, because it's an opportunity for you to develop personally, have a really good, these experiences in your life. So before being real adults, don't forget to have fun. Don't just dip into studies. GPA, of course, is important. Whatever people will tell you that they achieved something with GPA 2.0, it is possible, but it would be really stressful. Try to keep it at least above 3, because majority of stuff requires you to have GPA above 3. But don't forget about your mental health, because you're also a person who can burn out. You're also a person who can be stressed, and your emotional well-being is much more important than whether you completed your homework or not. And don't be afraid to be honest with your professors, because professors are also people. They are also ex-students, and they understand whatever you're going through. So yeah. And I also agree with Zhazira and Abuali. Don't forget that you have seniors who are actually really ready to, who are actually willing to help you if you want to. So yeah, as we're usually finishing our medical interviews, are there any questions you have or anything you would like to share apart from that?
This interview actually made me again to remember all of these moments that we had during our 4 bachelor years, and those were the precious years, so we need to value them. We need to remember all of the things that's happening with us, except the academic part. So you still have friends. You can be friends with your faculty. you need to game intense your mental health, agree with you. So the study is not only about the study, it's only about having a social life, yes. So
Yes, thank you, Altynay, for this interview.
Yeah.
Well,
thank you.
Yeah, I would like to thank Academic Advising Office actually.
oh yeah, thank you all. You are the best.
Don't forget that Academic Advising Office exists. These are you actually people who are your advisors, and if you have any questions, of course you can go to them. So I also like to thank Abuali and Zhazira for joining us and sharing their experiences. I think they won't mind if you text them. You want?
Of course, you can text us.
Anytime,
Okay.
any day.
Yeah. So you can listen to AAO Radiolab 1 at any platform you're listening to your podcasts to. And with you today were
Abuali from BMS.
Zhazira from BSN.
and your lovely guest host Altynay from Biology Sciences. Yeah, good luck, guys.
Ooh.
Bye.